Hey everybody, Dr. Josh Axe here. So excited to be here with you today, and so excited to be with my good friend, Dr. Lee Erin Connealy. And she has an amazing functional medicine and integrative medicine practice in California. And I've known her for several years. In fact, when I have patients that are struggling with some severe health issues, a lot of times I send them her way. And so she is an expert. She's written several books on fighting cancer using diet and nutrition and supplementation. So I love her heart and passion for helping people use food as medicine and all things natural to help people get well. And I know that Dr. Lee Erin has worked with people, helping them reverse diabetes, helping patients fight cancer naturally, and helping a lot of women and men balance their hormones naturally, which is a big thing as well. So Dr. Lee Erin Connealy, hey, thanks for being here with me today.
Great to be here with you, Josh.
Well, awesome. Well, one of my first questions for you is, when looking today, a lot of people are searching for answers. And there is so much conflicting information out there on the internet. And, one of the things I think people would love to know is, what is the difference between, your conventional doctor that most people go to, whether it's an MD or an osteopath, versus when people call themselves integrative medical doctors or functional medicine doctors? What's the real difference there? And then how do you practice differently?
Right. That's a great point. I'd love to clarify that. Well, first of all of the doctors here in my practice are conventional Western medical doctors. And what that means is they all went to medical school to learn really how the body works. Now, of course, we did take pharmacology classes to know the medications that would maybe help somebody in an emergency. I tell people we lead the world if there's an emergency, and sometimes you need medication to implement in a patient to fix them. But when it comes to healing, we've got to use these new functional medicine integrative approaches. Now, I've been practicing 33 years, about 45,000 patients later. And I started my practice 33 years ago with a nutritionist that we know, Hippocrates said, let food be your medicine, medicine be your food. And so from the very beginning. Now, since 33 years ago, lots of new science of medicine and biological medicine has come out from everything. I mean, it's amazing, the power of food, the power of really how the body works. So we learned something called the Krebs cycle of energy in medicine, okay? The Krebs cycle of energy is how the body works and produces energy. They just came out with an article called Metabolic Diseases. Only 10% of the population has the metabolic machinery to prevent illness. So every doctor needs to know the fundamental matrix of the body in order to get people well. So if you come here, yes, we do blood pressure, plus we do the whole gathering of their history. We do a great physical exam, probably a much more detailed physical exam than others, because we know how to look at the whites of the eyes, we know how to look at the skin, we know how to look at things in an in-depth fashion that we have learned over the past years. If you go to a regular doctor, he says, okay, what's your problem? Let me do a little blood work. They don't do very extensive blood work. And they go, okay, here's the drug, and see you later. So the World Health Organization publishes that 80 to 90% of illnesses are due to eating and lifestyle. When does a conventional medical doctor talk to a patient about eating and lifestyle? Never. But that's what's published by the World Health Organization. So we are not doing our job. So doctors now, unfortunately, have to start reading, going back to school, going to this course, because doctors like to understand the science and the validation of why they're doing what they're doing, which is what we do all the time. Our team of 7 doctors, we go to conferences all the time to learn the latest and greatest, all the time, the most innovative therapies, not just in the United States, but around the world, because the United States now ranks 45th in the world in healthcare. We are the leader in the world of chronic diseases. Now, we are spending twice as much, Josh, and we're getting people sicker. That's not okay. We have to take a stand for the salvation of humanity.
Yeah, it is kind of surprising when you do look at all those stats, and I know that I've been looking at them for, 15 plus years, and just looking at, hey, we are spending more than about any other country, and yet we are sicker in terms of chronic health conditions, everything from cancer to heart disease, especially diabetes, than a lot of these other countries out there today. Autoimmune disease, of course, is just running rampant in our country, and so obviously we need to change things up. And I will say, I've been encouraged over the past 10 years. I've seen things start moving more in this direction of using more functional and integrative medicine, which I know is something that you practice, and I know you've got a couple clinics there in California where you practice this integrative medicine. And so if anybody wants to check that out, you can just search Dr. Leigh Erin Connealy, and Leigh Erin is spelled Leigh, and then Erin Erin, and then Connealy Conneally, I believe. So Leigh Erin Connealy, and but her clinics are amazing. And so if you're a person out there struggling with whether it be cancer or diabetes or severe hormonal imbalances, those are some of the things that she specializes in, and I know has seen great results in. And using natural means, including diet and herbs and other things to help people get healthy and well. So talking a little bit, Dr. Leigh Erin, about the book you wrote in the past, this Cancer Revolution book. Can you give us a little bit of insight into sort of what you cover in that book?
Okay, well, first of all, I'm going to tell you why I wrote the book. So I was born in the 50s, and I'm number 3 of 6 children born in Houston. I was born in Texas, and my mother started bleeding. And so at that time, she went to the doctor, and they told my mother that we needed to give her a medication called DES, which is a very potent estrogen to prevent the miscarriage. So lo and behold, 16 years later, I come home from school, and my parents said, well, we received a letter that the drug that I took when I was pregnant with you caused cancer in the male and female offspring, as well as hormonal problems, as well as anatomical, all kinds of things. So I'm in Houston, Texas. I go to the Ivory Tower, MD Anderson, and begin the journey of uncovering what's effects DES had on me, not to mention all the last 45 years of quite unusual experiences. So my whole goal in my whole life is how not to get cancer. And so as a result of that, and seeing patients for all these years, and it's really, really heartbreaking when you see a patient who comes in weak as a kitten, who can't even hold their head up because they've had brutal, terrible treatments that have made them so weak. And we as doctors, it is our job, doctor means to teach. It's our job to teach the patient how to take care of themselves. It's the job of a doctor to prevent the patient from deteriorating. We shouldn't be a bystander and just watch the patient decline with the treatments. If, for example, I will give you an example. If a patient's going to have a PET scan, which is 600 times the radiation of a chest x-ray, we as doctors should protect the patient from the radiation damage, correct? Because we know that. It's published everywhere. If the patient's going to have a biopsy, we need to emotionally, physically prepare the patient for a biopsy. I talk about this in my book because why a biopsy is an invasive, injurious process that causes inflammation in the body, causing a cascade of reactions that can be unfavorable to the patient. So why wouldn't we prepare them for that? Then if there's surgery, we need to prepare the patient emotionally, mentally, physically for that surgery. Then if they do chemotherapy, some patients have to do chemotherapy. Now in our clinic, we use insulin potentiation therapy, which relates to your book, because what do cancer cells like to eat? Sugar. They have insulin-like growth factors. Otto Warburg got a Nobel Prize that cancer cells thrive from eating sugar. So we use insulin as the Trojan horse escort to bring chemo into the cancer cell, but we only use 10% of a normal dose, whereas a regular doctor will use 100%. But at the same time, we've already fixed the matrix and the foundation of the body, meaning all the nutritional deficiencies. We put them on purification, which might be liver cleanses, infrared sauna, baths, all kind of thing. Plus, we've worked on the patient emotionally, because guess what? When you have cancer, you're scared to death. And then the doctors use fear mongering to say, okay, you got to do this treatment, which we know the survival rate is only 2% if you do surgery, chemo, or radiation. So in my book, Cancer Revolution, I talk about, one, here are all the markers that you can even do on your own to know if something's trying to happen, brew in your body. Here are the preventive measures. Here are the signs. Here are the physical signs. Then if you get diagnosed with cancer, here is a roadmap for you to follow, a guidebook for you to follow. And in that includes the ketogenic eating program, which you just wrote your book about. And people think that you just get diagnosed, which takes about 10 years from one cancer cell to tumor formation is 10 years. People think it just goes away and you're cancer free with a quick little surgery and maybe some chemo and maybe some radiation, and voila, they're fine. There is no way a 10-year process can be dealt with in a couple of months, let's say 6 months of treatment total. And if you have not changed the terrain of the cell, you can look at the person's blood cell under the microscope in the terrain. If that is not healthy, the cancer comes right back. If the patient is emotionally stressed, the cancer comes right back because you have not changed the living condition of the patient.
Yeah, it's a very different way of looking at things, I know, than our conventional medical system. But there's something you brought up, changing your terrain or your environment. And that is so key. You know, one of the things that I would share with my patients, Dr. Connealy, is that, imagine your body as sort of this big bucket. And if you keep garbage in there, you know what, you can, it's going to attract rats, it's going to attract bugs and invaders. And if people a lot of times just want to kind of try and shoot these little bugs with, whether it be antibiotics or chemotherapy or other medications, but until you remove that garbage and clean it out and change the internal environment there, it's never, you're never going to stop sort of creating this, creating cancer cells, attracting parasites, funguses, allowing yeast overgrowth in your body. And so again, that's one of the things I love about you and love about what you teach, is that, again, this just makes sense. We've got to change our internal environment. It's not something that happens overnight. People need to change their internal environment. They do that with diet. They do it with changing, in creating healthy emotions rather than a lot of these negative emotions today, getting rid of the fear, the worry, the anxiety, the grief, the anger, and, really start working on, having joy and peace in their life. So anyway, I love that, and it's very holistic way of approaching and taking care of people. It's the way when my mom had cancer, it's the way that we approached it. My mom, first time she had cancer, she went through conventional medicine and was diagnosed as cancer-free, but seemed sicker than ever. 10 years later, cancer showed up again. And then we took a natural approach. She followed a keto diet. We started using herbs like turmeric, using reishi mushroom, using vitamin D therapy. She started big time. Probably the biggest thing was she really combated those emotions and built a lot of joy in her life. And, the tumor shrunk in half by, 4 to 6 months later, a year later, almost complete remission. But yeah, it wasn't this overnight thing. And she didn't stop eating healthy. It was sort of this lifetime thing now where it's, 13 years since then, and she's still,
she's still thriving.
Yeah, thriving. And so anyways, I love so much about what you teach about with that specifically, and I think it's great. Talk about this you mentioned the ketogenic diet a few times. What are your thoughts on, because, when I first learned about the keto diet, I learned about it because I was doing research on diets for cancer. And that's how I stumbled across the diet. So when I put my mom on this sort of keto diet, for her, it was very high in real fats, loads of vegetables. But then on Instagram today and Pinterest and Facebook and YouTube, there's these recipes for, like, I saw a recipe the other day for a fried cheese bacon quesadilla. It was called a keto quesadilla with literally conventional cheese, butter, and bacon. And that was the only thing in it.
Oh, gosh.
Any thoughts there?
Yeah, well, it's kind of interesting because people, we in America, only in America do we kind of distort something that's can be potentially beneficial for patients. And so for the longest time, since I've had a nutritionist in my office for 33 years, some kind of person who can direct people with their eating. Of course, I know a lot about it because I studied it, and it's kind of a funny story. I wanted to know how I would start my first practice. And I said, okay, how can I get a lot of patients quickly? Well, I specialized in weight loss, okay? But from a metabolic perspective, like what are your hormones, right? And what kind of eating? Anyway, and I tell people there's 2 cardinal rules that we all need to follow. 1, you got to get off sugar. Sugar is a destructive, food, period. And sugar is disguised in many forms because people think they go to the store and they get yogurt, organic yogurt, and they think, oh, this is great. Well, no, there's a lot of sugar in yogurt, for example. People think they don't understand how sugar is disguised in so many food products. But if you just stick to what nature, the bounty of nature, you're going to do pretty good. But because we have so much manufactured food here, more than any other country. If you go to Germany, you eat real food because that's what people have. There's not a lot of fast food places.
Yeah.
But we've got to teach people. People talk about other addictions, but sugar addiction is the worst addiction. And once you start people eating sugar, they literally can't get off. Then there's the unfavorable carbohydrates, which are bread, rice, pasta, and potato. And so all of our food today, unfortunately, is GMO'd, and it's really been destroyed compared to how I grew up 50 plus years ago. So, but people need to basically eliminate that and focus on the power of fat. I tell people, fat is what gives you energy. All right. Even fasting, even in my practice, I have a lot of patients do fasting because if they have cancer, we just need to starve and stop everything. Do you know what I'm saying? And I had a patient. I'll give you an example, Josh. I had a lady, her husband was a minister. He died a couple of years ago. She came in and she told me, and she says, she has a lump. And she said, Dr. Connealy, I don't want to do surgery or chemoradiation. So I said, okay. I said, I have a great plan for you. I said, I want you to fast for 30 days. So every patient, usually their jaw drops. What? I go, no, tell me. What do you think you can do? Well, this lady said I can do 30 days. I said, okay, 30 days. I said, if you're dying, eat avocado. Like if you're just can't handle it, I said, eat an avocado, eat a tablespoon of fat. So she comes back in 30 days. I said, I'm going to remeasure your breast mass. Well, just with fasting 30 days, it decreased 50%.
Wow. Amazing.
There's no drug that does that.
Yeah.
Okay. Not to mention, what did it physiologically do to her body? She cleaned her body up. She was a different person. Okay. This has happened over and over again. So fasting is a great way to jumpstart somebody. Now, if I have a person that's 111 pounds, obviously I don't tell them to go fast because they're frail and they can't do that. But fasting is amazing. But so we as practitioners need to meet the patient where they are, right? So sometimes it's fasting. For sure, a lot of the patients, you mentioned earlier that we have lots of diabetes and prediabetes. About 80% of the population is prediabetes or diabetic. Now, we do a blood test on everyone. One of the blood tests we do, which I talk about in my book, is the hemoglobin A1C. The hemoglobin A1C is a reflection of your blood sugar over 90 days. You can also do fasting insulin with that. if your blood sugar, most people have high blood sugar today. Children have it, young adults have it, and older people have it. Sugar causes Alzheimer's, heart disease, and cancer. And so we've got to deal with that. So the first thing we have to get patients to do is get off sugar and unfavorable carbohydrates.
Yeah, I couldn't agree more. In fact, it's one of those things where I think, when you look at sugar versus fat, a lot of people still think that fat is what turns into fat in your body. We know consuming sugar turns into fat, and it also turns into and feeds cancer cells and causes severe inflammation, which can cause your body to start lay down, creating scar tissue because you're essentially injuring all of these different areas of your body. So I couldn't agree with you more that sugar and these refined grain products are, the biggest villains that we have. They're what are causing our insulin levels to be off. And I wanted to say this too. Now, I'm a big fan of, and if people ask me how I eat today, I actually eat what I would call a Chinese medicine-based diet. I study a lot of Chinese medicine, Ayurveda.
Right.
And rice was a big component of a Chinese medicine diet. Okinawa, Japan, that has the largest amount of centurions. They consume rice there. But I think what a lot of people don't realize is, the type of rice they're consuming. It's a sprouted grain. It's cooked for a long time, typically into something called kanji. But still, carbohydrates are not 60 to 70% of their diet. I think that's one of the things that people don't necessarily get is that today our carbohydrate consumption is so high in terms of our overall macronutrients. Like what somebody considers normal carbohydrate consumption is wildly high. I think probably a good rule of thumb is, looking at more of those macronutrients should be pretty equally balanced, close to a third each versus most people are consuming double of that in the amount of carbohydrates they're consuming daily, which is just too much for our bodies to handle. And also missing the nutrients with it, consuming berries. And I'll say this as well, as I study a lot of sort of Asian or Chinese medicine, the other thing that they had in their diets that we don't today are herbs. They consumed about 8 times the level of antioxidants. And this is true. I read a book called The Okinawan Diet.
Right.
And they compared and they said that in North America today compared to Okinawa, they consume 8 times the levels of antioxidants. And they're getting those antioxidants from herbs and spices. That's where they're getting them. And so when I use the term, like my tagline on my website is food is medicine, it's the most true with herbs and spices. If you're comparing turmeric and cinnamon and rosemary, even to broccoli and kale, turmeric and cinnamon and rosemary blow broccoli and kale out of the water in terms of nutrient density, phytochemicals that fight off cancer. And so anyways, that's another thing I did want to mention too, is that as we're talking a lot about fighting cancer, I totally agree with you, bringing that sugar and refined grain consumption down, getting the healthy fats, replacing that. In addition, hey, let's use some of those herbs there as well to help fight disease.
Right. Well, we've been using herbs in our practice for a very long time, and unfortunately, in the United States, people, if you go to China, they write your little recipe, and then you get a bag. It looks like twigs and bark and all kind of things, and then you go boil it, and then you go strain it, and then you go boil it again. So, the average American, so we, need capsules of pills. And so you're right. Herbs are so powerful. You mentioned a few, but there are so many wonderful herbs that have the natural energy force that our body needs. I mean, medicines are all negatively impacting the body in some way. Okay. They all destroy the mitochondria, whereas herbs, they work as a family. I don't know if you've ever seen how they describe herbs. They have the king and the queen and all the royal family of the herbs. I'm sure you know what I'm talking about. Yeah, and awesome. So it's this synergistic flow of all these herbs that work together that change the cell.
Yeah, it is incredible, and that's one of the things especially I love about Ayurvedic medicine is that they were so strategic in their formulations and also deciding, hey, pairing these two herbs together has an even more powerful effect on the body. We've seen this in Western medicine with turmeric. Turmeric, we know, hey, you got to consume it with black pepper to get it more into the cells, or a warming spice blend, which that ancient recipe for turmeric golden tea is a blend of turmeric, trickatu, which is warming spices of long pepper, black pepper, ginger, and then some sort of fat to help get it into your cells.
Right.
And so, but it's funny. It's like they've been practicing that for 3,000 years, and we just figured it out 8 years ago. Anyways, it's crazy.
The whole pharmacology movement, it tries to influence our patients, and we should be using. There's always a natural alternative with extreme evidence-based medicine to support these treatments. And I know that my patients, and probably the people you see and hear about, they all don't want to take medicines. Like today, when I was quickly getting ready, and there was a new drug now that you can sue the manufacturer because it kills the patient. I'm like, how does this even make sense? Like, how does this make sense? So it's very sad that we are not respecting the natural laws of the human body, and doctors are not, they're scientists. So one of the degrees of the scientist is to be open-minded. And then why wouldn't we just try these things to see if it wouldn't help? And why aren't we interesting our patients in the eating and the lifestyle and the foundational support, and so they can live the best life possible?
Yeah, I totally agree with you. It is crazy when you look at just how backwards our system is, and because it's all driven by money. I mean, we're talking about a trillion plus dollar industry. It's really sad. But lives are on the line, and that's why I so appreciate what you do is just in running your clinics and going out there speaking at different places and letting people know that there is a natural way. It's something I wish that my mom would have done before her first round of treatments. We were just never educated. That's the thing. Like growing up, my family was always into fitness, and I think we kind of assumed, hey, because we work out, because we're active, that means we're healthy. But we knew nothing about nutrition. We were eating out, fast food and everything else, and we tried sometimes. We thought drinking fruit juice was healthy. I look back now, and actually it said on the container it contains 10% fruit juice. And even it was fruit juice, that's not great, but the fact that the other 90%, I don't even know what it was. But all that being said, I think the truth is people need to be educated. And the saddest thing to me, Dr. Connealy, is that our medical system today, the entire thing is based off of fear. It's putting fear into people versus giving them hope, And so we know, you and I, how important these emotions are we experience. And you've read the studies on this as well in terms of what happens psychologically to a patient when you tell them they have 3 months to live.
Right.
Or that they have to do this and it's their only way. It's absolutely crazy. I mean, I saw a study where they said, where they told people they have, 3 months to live, and they didn't even have cancer, and they still passed away.
Exactly. Well, yes, and that is such a huge thing. I tell patients that doctors, when they went to medical school and training, did not learn how to give an expiration date. So I always tell people, if you look at the record of spontaneous remissions, they are real. They keep track of it. So that's one of the first things we do in our visit is change the mindset, getting in them. We give them healing affirmations because a lot of patients don't know how to do this on their own because they're so overwhelmed with their diagnosis and overwhelmed with the treatment options. They don't know what to do. And so then we've got to, lay it all out for them in a very distinct plan and show them why we are going to do this. But the emotional aspect, because we already know, I tell people, the body follows the head. You become what you think about most of the time. And people must eliminate all the unfavorable emotions. You talked about envy and hate and jealousy and unforgiveness. I tell people we must remove all of those healing blocks in the body. And they are, without a question, healing blocks that will not even allow a treatment to work, Josh. If chemotherapy will not work if you're in sympathetic mode.
Yeah. It's huge.
So yeah, because sympathetic mode, what does it do? Increases metastasis. So the patient must be calm. We have our patients, before we do insulin potentiation therapy, we have them listen to calming music, neurofeedback, because we want them to receive their treatment in a peaceful manner.
Yeah, it's huge. I love that. Well, it's good. Well,
Well, I want to talk to you just briefly. Tell me about what brought about writing this book, your
Oh,
keto
sure.
book.
Yeah. So for my book, it really did stem from my mom who was diagnosed with cancer. And again, that's how I learned about keto, was searching online for remedies for cancer. And again, I found the keto diet and Otto Warburg and his and all of his research on sugar feeding cancer cells. And so that's really the reason why I wrote the book. And then the other thing is I saw all these people out there that were starting to do keto, but doing it the wrong way, where they were
Right.
eating conventional meat, bacon, and butter every single meal.
Right.
And so, and I use this in my practice as well. I used it with a lot of patients especially with insulin resistance, patients who needed a breakthrough with type 2 diabetes, type 1 diabetes, and people need to lose weight quickly. And so, anyways, I wrote the book for that, and I'm really excited about how it came out. We have a keto cancer plan in the book where we
Right.
incorporate vegetable juicing and a
Yes.
lot of Chinese herbs
That's what
and
I saw.
immunotherapies as part of it. We have a keto plan for those looking to heal their gut, those who are looking to balance hormones. And so the book is just called Keto Diet, and people can pick it up nationwide. People should go to their local bookstore and grab it, or Barnes and Noble, or something like that. You can find it online too, places like Amazon. But so that book I think is a great thing to pair with your treatments and visiting you, if that's what they're looking to do in terms of fighting cancer, balancing hormones, or if somebody's looking for a good integrative medical physician in the state of California. Or I know you have people flying from all over the world to see you, of course, as well. So I want to encourage everybody, hey, check out Dr. Lee Erin Connealy. Just do a Google search online, and also check out her Cancer Revolution book. I want to say, Dr. Lee Erin, hey, thanks for joining me today.
Great to see you, Josh. Thanks for being here.